I wanted to get
Good
your
morning, Mike.
opinion on. I wanted to get your opinion on two things: testicle sunning for testosterone, and also what herbs you might recommend for thyroiditis. Slightly elevated Hashimoto's antibodies.
Mike, your first question is what I recommend for testosterone?
Well, that, but also more specifically, testicle sunning, where you sit with your testicles in the sun for a period of time.
Yeah. All right. The thyroiditis, Mike, I'm not gonna talk because I'm not gonna answer because I don't think I'll be able to give you a good answer. I don't see a lot of thyroiditis in my practice. And I did study it, and when I first started practicing, I saw a lot of thyroid problems, but that's no longer the case. I primarily just see prostate problems, prostate cancer, testosterone, and things like that, male problems. Okay. And yes, men can come with these problems, but I just don't see it that often. With regards to sunbathing your testicles, here's the deal. I've been in natural medicine for 25 years, and I've gone to conventions and I've heard all these things. While I am an out-of-box thinker, and I have to be for my patients, and I can kind of do things and I recommend things that are not like randomized trials, I do need some sort of scientific support with everything I do. I think that's very important. I say that because throughout the 25 years, and I love my natural community very well, very much, but I've seen some craziness happen out there that people are doing in hope of getting better from something. And so, and then then it has to go with it has to come to the practicality of doing some of these things. And I'm sure that some guys can hang around with their testicles floating around, exposed with, exposing themselves and, getting sun exposure to that area. I don't know the benefit of that. I don't know what it's supposed to do. I don't know. I mean, what, increase testosterone levels through sunbathing? It's hard for me to make that connection where I would ever recommend it to someone to do. So I think there are many other ways to optimize your testosterone and androgen levels. And I'm not sure that sun exposure to the testicle area is one of them.
Thanks very much for your candor on that, Doctor. And let's now go to Kim S. Welcome, Kim.
Hi, thank you so much. This has been a great presentation. My father has been battling stage 4 prostate cancer for the past 2 years, and he's a patient at Smilo Cancer Center.
Ooh. Yeah.
And he did a round of chemo, and he was pretty healthy before, but since, like what you were saying, since his diagnosis, he adopted a whole foods plant-based diet, and he's always been physically active, so that's not a problem. He's been on Lupron shots for every 6 months, and the cancer spots dramatically improved. His PSA got down to 0.5. He started Xtandi about a year ago when his PSA started creeping up. So now his PSA is 5.8, and he actually, some of the, cancer spots have actually disappeared or dramatically reduced, but now he has 2 hot spots on his hip and his 6th rib. So we're looking at radiation. So is there any advice you can, or suggestions you can offer in his situation?
Kim, how old is your father?
He is this year, he'll be 77 years old. But you know what? He's in excellent health other than that. Okay. He looks amazing.
Great. All right. It obviously, as you can imagine, Kim, there's more, the devil is in the detail, and there's more information that I would need to give you the best answer that I can give you. So I'm just going to go by the information that you just gave me. my podcast actually, so one of my recent podcasts is on William Hurt, and I spoke about, because he had advanced prostate cancer. So there's a lot of information there that I think will be valuable for you and for him. Bone metastasis is not necessarily a life-threatening scenario. So we want to be careful with treating every cancer spot, because there's significant side effects that can come from that. And then now his quality of life can diminish. Now, it sounds like despite of all the Lupron shots and the Xtandi and the chemo, he's still doing pretty well. And I love to hear that. But at one point, will there be too much medical treatment where now his quality of life diminishes, and then, you know, his longevity also might diminish as well? I don't know the answer, because I don't know your dad's details, the details of your dad's case. What I would say is that bone metastasis is not necessarily life-threatening. He can be highly functional with bone metastasis, and may or may not be a good idea to treat those. I don't know, honestly, but there have been cases where I've recommended against treating some lesions in the bone, because I thought that will diminish their quality of life and not necessarily improve their longevity. So I would listen to the podcast on advanced prostate cancer, where I talk about the disease itself and William Hurt's situation, which I think you'll find helpful.